At this time, I have the pleasure of introducing our keynote speaker, Dr. Ahmed Ogwell Ouma, the Acting Director of Africa CDC. In his role as director, he coordinates with member states of the African Union to address disease and public health. With over 25 years of experience in public health, Dr. Ogwell is a longtime advocate for health systems reform, working with numerous health organizations to oversee local and country-level health policy changes by prioritizing the needs, ideas, and epistemologies of the African continent. We have been witness to his tremendous leadership in the continent's response to COVID-19. I'm absolutely honored to welcome him here with us. Dr. Ogwell, we're very delighted to have you. Please take the stage.
Thank you very much, Louise, and good morning, at least here. But for those online, it will be good afternoon, it could be good night, it could be good evening. And I must say that an inaugural event that attracts in excess of 1,200 participants is one whose time has come. Probably we are a little late if we have so many people interested in joining. And this is testimony to the fact that the world is becoming, I don't want to say smaller because it has not reduced in size, but certainly we are becoming more connected and our issues are becoming very, very similar. So it's an honor to be here, and my sincere gratitude to the Harvard Global Health Institute for inviting us at Africa CDC to participate in this inaugural Global Health Symposium. And we are also very pleased that this inaugural symposium is seeking to explore global health equity issues through community engagement. In fact, for us at Africa CDC, equity and community engagement are not just words. They are often the very difference between health security on the continent and catastrophe. When you don't engage with the community, you don't get to know when an outbreak has begun, and therefore your response takes weeks, and many, many lives are lost, and many more are disrupted. When you don't have equity, it means that the most vulnerable are the ones that receive any kind of support last, if at all they receive it. So when we hear equity and when we hear community engagement, for us, it is sometimes the difference between health and catastrophe. Today, the world is grappling with unprecedented challenges, not just in health security, but in security in general. It has become a much more dangerous place than it was many decades back. Unfortunately for health security, these challenges often translate into economic difficulties. It translates into disruptions of the social fabric. Indeed, health security has become a critical issue that affects all of us differently, but it affects all of us. For us, it is not just about preventing pandemics. It is not just about avoiding bioterrorism, but it is also about ensuring that everyone has access to quality healthcare as we accelerate progress towards a world that is safer from disease threats and health emergencies. Our goal at Africa CDC, the Africa Union, is health for all. And we are very pleased to see that this year's theme for World Health Day indeed was health for all. Over the past few years, we globally have seen how quickly a disease can be able to spread across borders. We have seen how devastating the consequences can be. And in fact, when we look back at the challenges we had with the Ebola virus disease outbreak in West Africa, and we mirror that with the challenges that we've seen with the COVID-19 pandemic, we see how exposed the world is. These large outbreaks have exposed existing disparities within and between countries, And they have been painfully reminding us that the multilateral system in the world has significant limitations when we are all faced with a shared health threat. This is not to say that the multilateral system failed, but it is to say that it was never designed to handle the kind of challenges that the world is facing today. That is why reforming the multilateral system is not only urgent, it will help us to avoid future painful experiences. We have seen firsthand, particularly in Africa, but also including the global north, we have seen how important it is to have robust health systems that respond quickly and effectively to any disease outbreak. Allow me, ladies and gentlemen, to remind us that today in Africa, it's the middle of April, and yet we have already experienced 44 outbreaks. 44 outbreaks. 19 of them were serious. In fact, apart from 19 being serious, as we speak today, as Africa CDC, we are actively responding to 5 of them. And this includes the simultaneous Marburg virus disease outbreaks in Tanzania and Equatorial Guinea, as well as the devastating cholera outbreaks across the continent, which have been made much, much worse due to the effects of Cyclone Freddy, particularly in the southern part of Africa. And we need to keep in our prayers Madagascar, Malawi, Mozambique, and parts of Zambia. The situation is not pretty, and the health situation is even more dire. Disease threats and their devastating consequences are not just real in Africa, they are becoming rather regular. And the effects of these disease outbreaks continue to weaken the health systems, and they also continue to disrupt our economic ways of life. The COVID-19 pandemic and these other multiple disease outbreaks have reminded us of the urgent need for a collaborative approach towards global health security. That word global is often forgotten when we are faced with threats, as we have seen during many of these outbreaks. These experiences that we faced have once again taught us that different countries must work together to build robust, resilient public health systems that can prevent, can detect, and respond to health emergencies in a timely manner. These experiences have also taught us that we can avoid or significantly delay the next pandemic if, and only if, we put the lessons that we have learned into tangible, urgent action. Unfortunately, where I sit at Africa CDC, we are not learning those lessons optimally. In fact, I am not so sure that we are preparing to avoid or delay the next pandemic. We seem to have forgotten about COVID, and we have quickly moved on. In fact, it is quite refreshing to see colleagues wearing their masks. We have forgotten that masks exist, and we have also forgotten that there were once things called sanitizers. But let me tell you a story. The story of an idea that evolved into a vision that then gave birth to the Africa Centers for Disease Control and Prevention, the Africa CDC. The story of a young institution thrust into the central theater of health emergencies and disease threats in Africa. The story of an African institution that is meeting its mandate despite the skewed landscape of public health globally. This is the story of commitment, a story of resilience, of action, a story of fidelity to safeguarding Africa's health. Let me tell you the story of a young African institution mandated by our heads of states and government to coordinate, to convene, and to build the capacities of African countries in public health and more urgently in health security. We've been asked to build the capacities of our countries to prevent, to detect early, to rapidly respond, and to build resilience before the next serious public health event. Many do not know just how young this institution is. Today, we are 6 years old, having been officially launched on the 31st of January, 2017. In these few years that we've been existing, we have documented hundreds of outbreaks on the continent. We have actively responded to dozens of them. And as we do that, we have learned lessons. These are the lessons that I would like to share with you today. Apart from learning those lessons, we have also taken the bold decision that we as Africa CDC and the Africa Union are going to put these lessons into alternative action. We want to see things change in the health security space in Africa and beyond, and we want to share our experiences so that the rest of the world can do better as we feel safer. It can no longer be business as usual. We are committed to make it business unusual because the situation on the continent demands and requires that the business as usual is no longer our way of working. Ladies and gentlemen, one major lesson we have learned is that global health security, in fact, that whole space is skewed against Africa. It is skewed against other regions who have resource constraints. If an outbreak, if you clap, the politician in me will talk for another 1 hour or so. If an outbreak is small, one lesson that we've learned, if an outbreak is small, it does not attract the required attention, neither does it attract the required solutions or resources. And a good example is Mpox. You know, last year, the Mpox outbreak on the continent started the conversation was last year, but for us, it started in 2020 in March, just after COVID. We spoke to everyone we thought we could be able to speak to so that more resources could be released to respond to Mpox outbreak, so that the stockpiled vaccines could be released to inoculate our health workers who are in the forefront. To date, 3 years later, not a single Mpox vaccine has arrived on the continent. Yet, of all the cases, thousands as they were, deaths have occurred only on the continent of Africa. Why? Because Mpox in 2020 was small, it did not attract solutions, it did not attract resources. When the outbreak spread to other parts of the world, the stockpiled vaccines were released. And interestingly, travelers were being given vaccines, while health workers on the continent do not have any vaccine to date. When an outbreak is small, as Africa, we are on our own. But when an outbreak is big, like we saw during the pandemic, the same resources are focused on other parts of the world who are better resourced, the global north, for example. So access to diagnostics and access to vaccines are challenged for us where the resources are constrained, but readily available elsewhere. It was very frustrating during the COVID-19 vaccination campaign when it started, for Africa to watch as 12-year-olds in the global north were getting vaccinated, and our health workers who were taking care of people who were unwell, some seriously sick, could not be able to get vaccinated. I hesitated many times to come to the global north, wondering whether it was worth it. When an outbreak is big, Africa is still on its own. This is the unfortunate yet painful reality that we face, not just in Africa, but other resource-constrained parts of the world. Second lesson that we have learned is that due to many factors, including climate change, many outbreaks are zoonotic. The reservoir is in animals, is in birds, and when that interaction continues to happen between the human and the animal kingdoms, and we find the zoonotic diseases jumping into the human population. And this is expected. We have urbanization going on, so we are occupying space that was never meant for humans to occupy. We are pushing the environment a little bit further, and that animal environment interaction ensures that as our habitats overlap, then we get exposed to more and more pathogens. That is why we have regular opportunities for emergence and reemergence and even spread of these zoonotic diseases into the human population. Ebola, COVID, Marburg, all these are just a few recent examples of that particular interaction. In fact, evidence is telling us that more is coming. Are we preparing? Where I said we are not. Are we expecting? Many are, but are still not preparing. That is why us at Africa CDC and the Africa Union, we have taken the very deliberate decision that we are going to work with our colleagues within the animal health sector, within the environment sector, so the One Health approach becomes the focus of our preparedness and our response. We want to ensure that peace times, we are building resilience so that if an outbreak comes, we are able to respond quickly using that One Health approach. The third major lesson, and the final one that I'll share today, is just how unequal the global health security architecture is. I'll give two examples. Today, 80 to 90% of HIV, TB, malaria, all the cases, they will be documented in Africa. Yet, when we look at the pharmaceuticals that we need, particularly the drugs, we import over 80% of what Africa is actually using in those three major diseases. Who's paying for it? International donors. How much? About 14 billion every year. When we look at human vaccines and we put aside COVID, Africa imports 99% of its human vaccines needs. We manufacture only 1%. When we factor in COVID-19 vaccines, the situation will be even worse. This is not sustainable. In fact, it is not safe for the world because Africa remains heavily exposed and in a way that puts the whole world at risk. And that's why I was saying that global health security, we often forget the word global when it comes to preparedness, resourcing, when it comes to response. That's why at the Africa CDC and the Africa Union, we have decided to do something real and concrete about these lessons that we are learning. Although I've shared three, there are many. The vast majority are very painful. Our heads of states made a call to action last year for a new public health order. This new public health order is guided by the principles of local ownership, local leadership, by equity, innovation, and self-reliance. The new public health order is aimed at safeguarding the health and economic security of the continent as we strive to meet the aspirations of Agenda 2063, the Africa that we want. The new public health order has 5 pillars. The first is strengthening of African institutions for public health, not just public health institutions, but institutions for public health. The reason for this is when you have institutions that address an issue on a daily basis, whether there is an outbreak or not, you're better prepared. You have better data collection. You have more experts that are dedicated to that particular area. Today, in the vast majority of the countries on the continent, even globally, health emergencies, our health workers are mobilized at the time of crisis. When the crisis passes, we go back to our usual life. We don't prepare effectively for the next one. So the first pillar is committed to strengthening these institutions for public health Africa CDC, the Africa Medicines Agencies are examples at the continental level, but we must also strengthen institutions at the national level as well. Whether they are national CDCs or they are called National Public Health Institutes, we must have agencies that are doing health security work 24/7 throughout the year. We'll be better prepared if we do that. Second pillar is strengthening the public health workforce. The range of experts that we need for effective early detection and rapid response is large. The gaps are huge on the continent. And that is why, as Africa CDC and the Africa Union, we have committed that we are going to train more experts. We are going to give them the right tools, and we are going to deploy them where they are most required. We don't want a health emergency worker doing administrative work, and then during an emergency is when he or she is plucked out of the office to go and do the emergency response. It doesn't work like that. And that is why we end up with large outbreaks that are preventable. So we need to train them, and we need to train them urgently so that they can respond to the emergencies that we have on the continent. The third is local manufacturing. $14 billion annually for only HIV, TB, and malaria. And that's only therapeutics. I'm not talking about diagnostics. Today, the continent does upwards of 15 million rapid tests for HIV. Not a single one is manufactured on the continent. It is a situation that sometimes when I look, I ask myself whether, as humanity, we are really serious. Because if production were to stop somewhere else, there will be no way of knowing what the burden of HIV is on the continent. Manufacturing of health products is our third pillar, and we have started that journey. You have seen manufacturing facilities coming up in new countries. Before, we had about 4 or 5 countries that were manufacturing human vaccines, and a little bit more who were manufacturing other health products. But we have new platforms coming onto the continent. You've seen what's happening in Rwanda, in Kenya, in Ghana, on top of what was going on in South Africa, Senegal, Egypt, and Algeria. So that need to expand local manufacturing is urgent, and it must cut across all health products and not just human vaccines or therapeutics. The fourth pillar is increasing domestic investment in health. We have something we call the Abuja Declaration, where our heads of states committed that 15% of every annual budget is going to go into health. Many countries have not reached that on the continent. And it is because of what I refer to as unhelpful support that comes from donors that introduce a little bit of laziness, if you want, in providing more investment into the health sector locally. The 14 billion I was talking about is helpful, but in the long run, it is sometimes very challenging to ensure that we are getting more domestic investment in the health space. It's something we have committed to do, and we've started that program very actively. In fact, we have a champion in one of our heads of states. President Paul Kagame of Rwanda is the champion for domestic financing. And the progress is slow, but there is progress. We are really looking forward to the coming years when we expand this as we talk about better preparedness for health security. The fifth pillar is to promote action-oriented and respectful partnerships. We know that we must do this on our own as a continent, but we are also pragmatic. We know that we don't have to do it alone. But as we engage in partnerships, those two characteristics are very important. They must produce action. We don't want partnerships and projects that will buy 4x4 wheel drive vehicles, air conditioned and walking through villages without much difference in the health indicators. Those projects are not working unless the health indicators are changing. We want them to be action-oriented, delivering differences, positive differences for the continent. The second characteristic is they must be respectful of the priorities of Africa. We set the priority, and then support can be able to address those priorities. Many health projects on the continent today are based on other people's priorities, whether it is research-based or a philanthropy that is interested in one area of work, yet the priority is in another totally different area of work. It skews the planning and it skews the allocation of human resource at country level on the continent. Promoting action-oriented and respectful partnership. This is our vision. It is our vision to address the challenges that we have identified. It is our vision to avoid the painful experiences that we have continued to experience on the continent. And this is our story. I invite you to be part of our story. We know that implementing the new public health order will require us on the continent of Africa to lead. We know that it will require support from many, both the willing and the unwilling. It will require that all stakeholders, whether it is our member states, whether it is our development partners, whether it is the donor community, irrespective of whether it is academia or research institutions, indeed the private sector, including the public in Africa and beyond, all need to work in a coordinated manner to deliver on this vision. We want to, in fact, let me say, we must achieve the ambitions of this vision so that we are a good example of how health security for one is health security for all. And I invite you to be part of this story, engaging with institutions on the continent based on the priorities of Africa. And as I conclude, being shown a little flag at the back there, as I conclude, I would like to end with the words of Nelson Mandela, the African leader and global icon, who said that, and I quote, "It always seems impossible until it is done." And we at the Africa CDC and the Africa Union, we are going to do what may today seem to be impossible. We are committed to implement the new public health order to make Africa safer, indeed, by extension, to make the world safer too. I invite you to be part of that story. Thank you very much.